Hello there. You are watching COVID Fellows, a video interview series with the administrative fellows working through the pandemic. Hi, everyone. I am Audrey Workman, an administrative fellow at Health Partners in Minnesota, and I am here today with a former classmate of mine, Antonette Shockey, who is joining us from California. Antonette is an administrative fellow at Sutter Health. And today she's going to share a little bit with us about her fellowship and how she's been involved in the response to COVID-19. So Antonette, thank you for joining us today. It's good to see you again.
Yeah, nice to see you, Audrey, and thank you for putting this together.
Yeah, of course. So I would love if you could just share and tell us a little bit about your fellowship generally, a little bit more about the structure and what you're doing.
Yeah, absolutely. So as you mentioned, I am a Sutter Health System Fellow, but the Sutter Health Fellowship is structured so we have, right now this year, we have 5 fellows, and we are all placed in different hospitals or what we call the medical foundation, which is the outpatient side of the organization. And I am placed at Sutter Davis Hospital, which is a hospital in Davis, California. It's a 48-bed hospital, so it's a small community hospital. It's in an acute setting, and I work directly with the CEO, who is also a Minnesota alumni. And the fellowship typically is a year. So I started in July of last year, and I was supposed to end in July of this year. However, due to the pandemic, my fellowship did get extended to October to make sure that I get the full experience, and also to give me a little bit more time in terms of figuring out what I should do post-fellowship.
Mm-hmm. Yeah, there's a lot of things happening in healthcare organizations across the country. So that's nice that you've got more time to plan, especially with the uncertainties of the future generally. It's nice to have that buffer.
Yeah, absolutely. And I think part of the reason is that we have an amazing executive sponsor, and she just wants to make sure that we have a full fellowship experience. And because the pandemic kind of took precedence of what's going on in our affiliate, it kind of created a different kind of experience for my cohort at Sutter Health. And I'm sure that's how it is across the nation right now with all the fellows as well.
Oh, absolutely. I think we're all healthcare leaders are learning and developing skills that they might not have been focused on a few months ago. Emergency preparedness comes to mind as one of the biggest takeaways from my experience at seeing how a health system responds and how they've been prepared. Could you also tell us a little bit more about what you're working on and how you're helping your hospital respond to COVID-19?
Yeah, so at Sutter Health, the Sutter Health system started our COVID preparedness back in January. That's when our system incident command center was activated. But my particular hospital did not begin ramping up our COVID response until mid-February. So with that, I've been involved in the surge planning and making sure that we increase our capacity, our hospital capacity by 40%, because that was asked by the governor of California to make sure that we have enough critical beds for the projected need in California at the time. I've also been involved in our emergency department tent workflows when we did stand up our tent back in February. I was helping our CNE, our ED manager with the workflows. I've also been involved in, because there are a lot of changes in terms of PPE coming down from the CDC, WHO, and from the Sutter Health system. Communication is very important, getting it getting the information down to the front line. So I was part of am part of a PPE task force to make sure that these new changes are communicated, and making sure that we have enough the right protocols and also processes to make sure that our front lines know how to don and doff the PPE. In addition, I've also been very involved as the EVS interim manager in making sure that we're supporting our hospital, our clinicians, and our care teams, and making sure that the hospital is clean and disinfected, and that we adapt to the processes and new changes needed to make sure that the environment is clean and safe for our patients and also for employees. So it's really a mixture of things, and I've really been fortunate, especially being in a small community hospital. You kind of get to wear multiple hats, and that I've really been able to be part of the team. When at a normal fellowship, you don't really get to be thrown into this much operations, or at least emergency preparedness type of projects.
Mm-hmm. Sounds like there's been a lot of change management as well. I mean, talking about PPE and just keeping up day to day with some of those changes from the CDC.
Yes, I think in the beginning of the pandemic, there was probably a new PPE change every other day or so. So part of the work is creating task force and making sure the communication line is very fluid and clear. So frontline staff are not anxious with these new changes, but that is a challenge, and that's something we're constantly learning from. And that's part of, being a fellow as well, is how do you adapt and how do you support the team in the best way that you can.
How does the work you're doing now compare to some of the work you were doing before the pandemic started? Has it changed a lot in what your focus has been?
So before the pandemic, I had already started my role as an interim manager of EVS. So that work has remained the same. If not, there was an increased focus in the EVS department, because it's such a crucial department. Yeah, where the EVS staff are those unsung heroes of healthcare, because without them, the facility, we can't really take care of patients. Rooms would not be ready. So I would say that work has remained the same. If not, it has significantly ramped up in terms of the needs from that department. But in terms of regular fellowship projects, the projects I was working on were more long-term. Definitely the timelines were, the completion were 6 months to 8 months, and they're waiting for big deliverables. However, since the pandemic has hit, or since it did hit, we have had to put that on hold and really just focus on the COVID response, because that's what we have to do for our patient right now. But in comparison, the projects that I have worked on in terms of surge planning and all the other projects I mentioned before, I mean, the timeline was days, weeks, if not a couple days, to get those rolled out, and just kind of learn as you implement, rather than with regular projects. Like, for example, I'm working on bringing teleneurology to our community hospital. You get to have more time to think about the operations and the logistics, the stakeholders. But during emergency preparedness, you don't get that luxury, because you just have to make the decisions and learn as you go. Because otherwise, if you don't make those decisions, it could significantly impact the employees and the patients.
Yeah, there's an urgent need for an urgent response. It's really sped up the timeline for a lot of work.
And you know me, we've worked on a couple of projects together, and you know how I like to think through everything. And so that's definitely something that's a skill set that I've had to significantly refine, is being able to adapt to situations and just move as you go, because that's sometimes as a leader, you have to just make decisions with the information that's given to you. And when you're in a pandemic, you're living in a world of uncertainty. And so you just have to be, I guess you have to be comfortable with the uncertainty and just make sure that you can learn and pivot as needed.
Mm-hmm. Well, are there any other specific learnings or takeaways that stick out to you through these experiences?
Yeah, I mean, I mentioned being able to like think on your feet and implement things quickly and learn and pivot. That's definitely something I've learned during the past couple weeks. However, another thing that has stuck out significantly is just having the appreciation, showing appreciation to your staff, to your coworkers, and just checking in and making sure that they're okay, really goes a long way during these times. I know that my hospital, we're a tight knit community, and we even just the small things for doing their job the way, that goes a long way. And buying food for people, and making sure that just the small things could really make someone's day when things are stressful at the hospital.
I love that. There's been a lot of publicity lately about people reaching out to support healthcare workers.
Mm-hmm.
And it's critical. It's meaningful and critical in these stressful times where our teams really are putting themselves at risk to serve the community.
Yeah, and I agree with that. In the community piece, one of the projects I worked on is I set up the community donation process for PPE and other, food donations for our frontline staff. And it's just within the first week, we just had, a lot of donation from the community, and it's just very heartwarming. And I know that my preceptor, who's the CEO of the hospital, we have a daily COVID update newsletter that she sends out to the frontline team, and she always makes sure to include some sort of recognition or appreciation from the community. So if they donate, pizza to the ER staff, she includes that. And I know that the front lines are feeling very appreciated right now because of the community support.
I love that. Yeah, if there's one good thing that comes away from this, I hope it's that our healthcare teams know how much we value and appreciate them.
Yeah, and because they really they take care of the most vulnerable, and they're putting themselves at risk. And and I hope that they do feel appreciated.
Great. My final question for you, Antonette, is how will some of the things that you learn impact you in your career?
Yeah, and that's a really good question, and I've had to really reflect on that. And kind of going off of what I mentioned earlier, during crisis and a pandemic, you don't get the luxury to think through the new processes and new workflows that are coming down, because you need to adapt to the new changes. And that's something I've really had to learn during this pandemic, is to be able to be okay with making changes without all the information, because we're living in the world of uncertainty. But something I've definitely learned, and I will take for the rest of my career, is it's okay to make these decisions without every information that you could possibly have, as long as you keep the patient in the center of your decision making and that you keep your employees' safety in mind when you're making these decisions. And that's really the best you can do. And if there are some mistakes along the way, as long as you have a great team, and that everyone's willing to collaborate and also pivot and make changes as needed, that's the best you can do. And that's something I'll be taking for the rest of my career.
That's a profound lesson, I think, and something we could all take away as healthcare leaders. Well, Antonette, I just want to say thank you for your time today. Thank you for talking us through some of the things that you've experienced. I just think there's so much value in understanding the perspective that fellows have through this crisis. And you're in the heart of California, helping to navigate some of these challenges, and you're doing great work. And thank you for letting us learn more about it. Thank you for watching COVID Fellows, an Admin Fellow video interview series. Follow Audrey L. Workman on Twitter or LinkedIn for more related content.